Welcome, my friends, to the Bob and Brad podcast. My name is Mike Keenitz, and today I'm interviewing Cynthia Konrath, who is the owner of Moderni Spine, and she is a physician assistant. At Moderni Spine, they are focusing on pain management clinic located in Minnetonka, Minnesota. Today, we are going to be talking specifically about fibromyalgia, including what can cause it, symptoms, and treatment options that may help. So without further ado, here's Cynthia. Well, welcome back to the program, Cynthia Konrath. Thank you for joining us today.
Yes, thank you for having me back.
Today, we're going to be talking about fibromyalgia, but before we get into that, would you mind telling our listeners a little bit about your background?
Yes, so I am a physician assistant. I have been practicing for a little over 6 years, and I've always practiced within some type of pain space. So spine, orthopedics, pain medicine, and I recently opened my own practice out in Minnetonka, Minnesota called Moderni Spine. So pain focused again, focused on spine ailments, so pinched nerves, but then also on joints, musculoskeletal, so muscle pain. So kind of all encompassing clinic.
Sure. So where can people find out more information about you at?
So you can go to modernispine.com. So Moderni is spelled Moderni, spine.com. Otherwise, people can always give my clinic a call too. It's 651-440-0939. But those are probably two of the best ways.
So I just want to clarify, your clinic, everything is in person, correct? Or do you offer any online stuff?
I do offer telehealth services after there's been kind of an initial consultation. Just with pain medicine, physical exam is really important to me. But if people need telehealth services just because they live farther away, that is an option too.
Okay, great. So we're going to get into the meat and potatoes of fibromyalgia. So the first question is, can you explain what fibromyalgia is and what causes it?
I can't at all.
Podcast over. No,
I'll try a little bit. No, but one of the reasons it makes this such an interesting topic is because there's still a lot that is unknown with fibromyalgia, but there's a lot of people suffering with it. So in a nutshell, it is a hypersensitivity syndrome, meaning that what someone normally might perceive a touch as not painful, someone with fibromyalgia is going to perceive that more as a painful stimuli. So there's some type of miscommunication in how the brain and the nerves are perceiving pain. What causes it is still kind of unknown. There are a lot of things or a lot of hypotheses that people are saying might cause it, such as an autoimmune disease. An autoimmune disease just meaning that your body is essentially attacking its own healthy cells. So some people might know different autoimmune diseases like rheumatoid arthritis, Sjogren's syndrome, Hashimoto's, or lupus. So those are all autoimmune diseases. That might be some underlying factor within fibromyalgia, but it's still kind of unknown.
Sure. So it's kind of like typically someone has some other underlying condition and this can become a side effect from it.
Mm-hmm. Yep. It can be kind of present on its own if they can't diagnose, maybe what triggered it. But yeah, there are a lot of other factors that they think sort of triggers the body into this syndrome or this disease.
So what are the common signs and symptoms of fibromyalgia that patients should look out for?
The most common signs are going to be muscle pain, kind of widespread pain throughout the body. So a lot of tender points or tender areas throughout the body. The most common places that they're going to present are sort of kind of that upper back, maybe the front of the neck, joints of the elbows, the knees, and then in that low back, the buttock, the glute muscles are kind of where some of these tender points present. But it's also going to present with other symptoms that sort of play a role in quality of life, such as fatigue. So people will be tired, they won't get a lot of sleep or not very restful sleep. There's something called fibro fog, meaning that there's some decrease in sort of mental clarity for people with fibromyalgia. So people might feel like they're starting to have memory issues, or they just can't think as clear. They can't remember what they were doing. So that's another symptom that could be in fibromyalgia too.
Is this more common with middle age or older adults, or doesn't it really matter?
Middle age is probably more common. So when we look at commonality of fibromyalgia, it's really hard because I feel without, and I'm sure we'll get into this later too, but I feel without having a true diagnostic test to say, okay, you have fibromyalgia or you don't, it's hard to say whether it's overdiagnosed or underdiagnosed. So there's could be a lot of people out there that are not diagnosed, or everyone might have it and maybe we're overdiagnosing it. So we do right now in clinical practice tend to see it more in middle age, but there is essentially like a juvenile fibromyalgia, and we do tend to see it more in women than men. Again, you tend to see more women go into the doctor for pain or for illnesses versus men. So that could be a reason why as well.
Yeah, we're stubborn.
You are. You're so stubborn.
My
But yet
girlfriend
you
tells me
get
all the
so
time.
sick with the common cold. It's just
All right. This is good leeway into the next question. How is fibromyalgia diagnosed, and what diagnostic tests are typically used?
so. As of right now, the main diagnostic tests are actually questionnaires. So going based on patient's history, and then questionnaires that look at or sort of grade how people are perceiving their pain and how their pain is affecting their daily life. So their ability to do just daily activities, make the bed, wake up in the morning, do the dishes, go to work. Those questionnaires kind of scale all of that. And then they also have people rank what their fatigue is like, what their sleep is like, how their pain is. Is it stiffness in the morning? Is it burning pain? And looking at the scores of all of those kind of help diagnose fibromyalgia. But that is the really kind of stubborn thing about this disease is there's not a blood test or an MRI scan or a CT scan that we can do and say, oh, you have fibromyalgia. So it's, as of right now, it should be in practice a diagnosis of exclusion, meaning we should really rule out a lot of other things, the big, bad, and ugly first before diagnosing someone with fibromyalgia.
That's interesting. I never honestly knew how it was diagnosed. I mean, from a physical therapy realm, like, we don't really see people just with fibromyalgia. Like, it's
Right.
usually something they have in cohorts with
In
another issue. But
conjunction. Yeah.
yeah. So yeah. Huh. I did not know that.
Yeah. There's been, I mean, there's been a lot of studies out there looking at different cerebral spinal fluid, urine, blood tests, and seeing some patterns in what might be elevated in patients with fibromyalgia. But there's no true standard for clinical practice right now. It's really just getting the history, making sure you kind of rule out other causes that do have diagnostic tests, and then kind of go from there.
Sure. Huh. So, what is the difference between fibromyalgia and other conditions with similar symptoms, such as chronic fatigue syndrome or rheumatoid arthritis?
So fibromyalgia, so back in, I think it was 1990s, is when they first kind of coined fibromyalgia as a fibrositis syndrome. And that was implying, with the itis part of the word, implying that there's some sort of inflammatory component. Now, looking at muscle biopsy tissue samples, looking at the joints, there's no actual inflammation that can be seen within those joints. Whereas if you compare it to other rheumatological diseases like rheumatoid arthritis, there is actually inflammation within that joint, and it does actually develop into joint destruction, especially if it's not treated. So that's probably one of the main differences, aside from rheumatoid arthritis having kind of actual lab tests set aside for being able to diagnose it, but you actually see that destruction of the joint or that inflammation, whereas fibromyalgia, you don't see that. With with chronic fatigue syndrome, so chronic fatigue syndrome and fibromyalgia overlap quite a bit. The main difference with the two of those is chronic fatigue syndrome is going to be very severe on the fatigue side of things and less severe on the pain side of things. And then fibromyalgia is flipped. You're going to get the severity of the pain is going to be the number one factor, and then you'll still get that fatigue. But so they're kind of a vice versa of each other. And again, both of those syndromes don't really have a good diagnostic test. So they're very similar. A lot of people think, essentially you could have both at the same time, but trying to weed out, exactly which one is which is a little hard at this time without those testing.
Sure. Yeah, I could see how they'd be so similar. It's just, do you feel more tired or more pain? Like, I guess that'd be the only
right. And then trying to split apart those diagnoses. And they both, chronic fatigue syndrome was thought to initially maybe start after some type of viral infection. So maybe thinking there's some type of inflammatory component to the brain after a viral infection. But then fibromyalgia also could be triggered by viral infections too. So yeah, how they start out and their risk factors kind of coincide a little bit.
So I'm guessing the treatment between the two is somewhat similar.
It's somewhat similar. Yeah, in terms of, looking at cognitive behavioral therapy, looking at different medications, things like that to manage. They're pretty similar. Fibromyalgia, right? You're trying to more so manage the pain rather than anything. And then the chronic fatigue syndrome, you're really trying to boost those energy levels.
Sure. So I kind of asked this question earlier. I'm ruining my own questions.
Oh my God. You can't ask it again then. Sorry.
I didn't get too in detail. How common is fibromyalgia and who is at risk of developing it?
Yeah, so we did kind of we just touched on it a little bit. Again, knowing how common it is a little difficult just because there might be some people that sort of jump to the conclusion of, oh, you have fibromyalgia without doing other thorough testing. So it might seem more common. In the pain space, we definitely see fibromyalgia. It's definitely common, at least in our world. Now, if you're in dermatology or something like that, you're going to feel like it's few and far between people with fibromyalgia. What was the other part of the question? You had a two-parter.
Who is at risk of developing it?
Oh, yes. Okay. Oh, Monday morning. So risk factors. So one of the pretty interesting risk factors is any history of psychological trauma. So people with a history of childhood abuse, childhood trauma are at a higher risk for developing fibromyalgia. People with a history of being a veteran, so PTSD from being active military, they're also at higher risk. And then any type of physical trauma too. So not just that psychological component, but any physical trauma. So a large motor vehicle accident or any type of accident that sort of triggers this abnormal response in the body that can eventually develop into fibromyalgia or some of those other chronic pain conditions. So there's a lot of talk too about hormonal imbalances, vitamin mineral deficiencies, things like that. There's a lot of components in, everyone's foot is in a little bit of a different pond. I mean, there's so many things that can go into it. And that's one of the things that makes treatment so difficult as well, because everybody's trigger to getting this syndrome or this disease could essentially be different. And so their treatment might have to be different as well.
Sure. Yeah. I mean, with neurological conditions, it's, hit and miss and everything varies so drastically.
Mm-hmm.
Well, this is a head scratcher of a condition.
I know, it really is. And it's out there and it's diagnosable, again, as long as you sort of rule out other things as well. But it's so interesting because it's like we know so much, but we haven't quite put it all together yet.
Sure. Okay. Can you discuss the challenges in diagnosing fibromyalgia, considering it's often vague and overlapping symptoms?
Mm-hmm. So kind of going back to what we were talking about before, I can't draw someone's blood and see that they have a low red blood cell count and say, oh, okay, you have fibromyalgia. And it's not a swab where I can grow some type of bacteria and diagnose it. So it's really making sure that if someone has painful joints, we want to make sure that there's not another rheumatological disease going on, that they don't have rheumatoid arthritis. If it's a single joint, then we have to look and make sure there's nothing wrong with that specific joint, because what fibromyalgia is going to present as is going to be more so widespread pain. It's going to be often symmetrical, so you're going to get pain kind of on both sides of the body at the same time, versus someone coming in with just a really painful, tender knee. Then you need to kind of really look into what's going on there. They should not be diagnosed with fibromyalgia. But really, the fatigue that goes along with it, looking at thyroid levels, looking at if they have any gastrointestinal symptoms, so looking at issues with the gastrointestinal tract. There's a lot of other diseases that we just need to rule out and make sure patients don't have before we say, okay, this might be fibromyalgia.
Does fibromyalgia kind of come in waves, or is it kind of a constant?
So it can come in waves. So one of the interesting things is, one of the diagnostic criteria used to be that patients had to have 11 out of 18 of these tender points on physical examination. So there were kind of these 18 defined tender points, and on a physical exam, patients had to meet 11 of those points. They kind of did away with that because it could fluctuate or come in these almost like a remission and then flare up. And so depending on the day of your physical exam, some of these points might not be tender, and then you wouldn't be diagnosed with fibromyalgia. So it can definitely kind of go into remission phase. I'd say most people, at least that I've seen, have some degree of sort of a widespread pain all the time, whether it be a stiffness, but then they can definitely go through a flare up where things are just really tender to the touch, difficult to move, but there's always sort of some degree of things there.
Sure. So, what are the available treatment options for managing fibromyalgia, and how effective are they?
There are a lot of options, depending on what route patients want to go. I mean, starting with the least invasive options, you're going to be looking at potentially doing some cognitive behavioral therapy. So, looking at different ways to meditate, different ways to reframe sort of accepting fibromyalgia, accepting, what your life is, what your limits are right now, and kind of, I guess, rebranding yourself almost. And then once you look at therapy, other options might be doing different nutritional or dietary changes. There is a lot of good evidence, so kind of level A evidence, that certain medications can be helpful in treating fibromyalgia. So amitriptyline is one of the medications, Savella. So basically antidepressants, tricyclic antidepressants, SNRIs or SSRIs, and then pregabalin, which a lot of people know as Lyrica. So those medications can be really helpful in some patients. I think one of the biggest things is, if you are diagnosed with fibromyalgia, just being patient in that journey, similar to depression and anxiety, because it's not a one medication or one treatment fits all. It's not an antibiotic I can throw at an infection and have it clear up for most people. It's definitely, kind of a trial and error sometimes with what medications you can tolerate, what works for you, and things like that. So there's definitely medications out there that can be really helpful in managing fibromyalgia.
So, you kind of talked about meditation and diet a little bit, but there are any other lifestyle changes that are non medical strategies people can try?
Yeah. So, yep, like you said, that we talked about the meditation, doing different supplements or within nutrition. So working with a dietitian, but other supplements that people can take over the counter, that can be helpful with fibromyalgia would be doing like melatonin, CoQ10, magnesium. So some of those supplements have been shown in smaller studies to help with the side effects of fibromyalgia, and they're relatively low risk to take. Usually I always tell people, make sure you at least meet with a dietitian or nutritionist, because maybe you're just not getting some of those things in your actual diet, and you don't need to go buy, 18 bottles of things at Target, even though we know that's so fun sometimes. But with the packaging nowadays, I'm like, I always walk past the aisles in Target and I'm like, oh, do I need that supplement? It's packaged so nicely. But if you're missing some important things in your diet, or vitamin D, things like that, that you can change by just eating a little different, that's one thing. Otherwise, over the counter supplements can be helpful sometimes with the symptoms too.
Sure. Is there any, I suppose the diet strategies are different for each individual too, huh?
Mm-hmm.
Yeah, I'd assume that.
Yeah.
So, how does exercise and physical therapy play a role in managing fibromyalgia? Maybe that question is meant for me.
I was literally going to say, I don't know, Mike, you tell me. What do you got?
Kind of how I mentioned earlier, it's not really a main condition we treat in physical therapy. Normally, they have some other issue and they have fibromyalgia on top of it. So, as PTs, you just have to be more aware of their pain issues and try to work around them and get them to move as much as they comfortably can without overworking them, pretty much, I would say.
Yeah. I mean, I would totally agree with that, right? Movement is important, and you probably know this, as a physical therapist, movement is very important just for mental health as well. So some of the activities that are recommended for people with fibromyalgia would be certain types of yoga, swimming, walking. You don't have to be a marathon runner if you have fibromyalgia. We just want you to get out there. We want you to move, and we want you to be aware of your own body. So, you don't necessarily doesn't have to hurt for you to say, okay, I did something. We just want you to get out there and move.
Yeah, oftentimes movement gets the good feeling hormones to naturally generate more throughout the body versus just sitting around. So,
Yep. And kind of just, right. If, everyone will learn sort of what movements or what type of exercises really flare up their body more than others. I've seen a lot of people get a lot of relief with swimming, especially in Minnesota in the winter when they can get inside in like a warm pool. Just therapeutically, it works really well for people. So that's a consideration too. As long as you're not like afraid of water, because that would just be a whole other issue.
makes everything worse. Are there any? Oh my gosh, hold on! I just screwed up my whole document there. Oh, there it goes. It's back. Okay. Are there any new or emerging treatments or research breakthroughs in the field of fibromyalgia?
There is always something going on. Again, not having a definitive test for fibromyalgia is not because of the lack of trying. I mean, there is always stuff coming down the pipeline in terms of how can we test this? How can we isolate it? In terms of treatment, some of the treatment options that might be available would be doing like a low-level laser therapy to the tender points for fibromyalgia to essentially reduce oxidative stress in the muscles and help with range of motion. Sometimes if we can reduce the pain enough, and even if that's with laser therapy and medications, if we can reduce the pain enough, it's going to give people that incentive to go out and move more. And then if they move more, it also helps in the long term with their mental health too. So, I think there's no kind of clinical standard, unfortunately, in how to treat this, which again is why it makes it so interesting. So I think, if you've been diagnosed with fibromyalgia, just making sure you're working closely with your provider in trying some of these things, giving them true feedback on how it's working. And that's going to help them kind of move along with the treatment plan, whether they add something or take something away. But laser therapy has been showing some promising results too.
Is laser like red light, or what What do you mean by laser?
So like infrared.
Oh,
Yep.
okay. So is it like a whole unit they just sit in?
So it's a laser tool, like an applicator that has, depending on what area you're treating, different number of diodes on it that
Sure.
will essentially put the laser. So you'd be treating kind of their most tender spots or most tender joints.
Gotcha.
And treatments are usually, about 10, 15 minutes. If you're treating the whole body, it can be a little longer than that.
Yeah, I think, do they kind of look like ultrasound machines almost?
Yeah.
I mean, the pain ultrasound machines. Sorry
Yep.
for listeners, not the pregnant ones.
Not the pregnant ones. No.
Not
Yeah,
the
they kind of
in-between.
look like the pain. Yep. Ultrasounds.
Okay, that's what you're talking about. Got it. So, what advice would you give to someone who suspects they may have fibromyalgia or have recently been diagnosed?
If you've recently been diagnosed, I guess one of my main nuggets of advice would be just make sure that you've had other workup done. So if you've been diagnosed with fibromyalgia and this is your first time going to the doctor in 2 years and you haven't had any recent blood work or anything like that, I would just kind of ask again and make sure that they're ruling out other things. Because again, like we talked before with the overlapping symptoms, there can be other things other than fibromyalgia going on. We just want to make sure that we don't miss any of that. If you're working through that diagnosis of fibromyalgia, just be really patient. Again, if we order a lot of lab tests, it's for that same reason of ruling out something that is more obvious or more treatable. And we're not discounting the thought that if you come in and say, hey, I think I might have fibromyalgia, we're not discounting that. We just want to make sure that we're not missing something. But there is, I guess another piece of advice is there is hope. There's definitely, like I said before, so much research going on regarding fibromyalgia, regarding how to diagnose it, how to effectively treat it. And there are a lot of things currently out there that work for people. They just work for people differently. So just again, being patient and knowing that hopefully your treatment regimen that we try will be helpful.
So, do you know of any like support groups or resources that are available for individuals with fibromyalgia or their caregivers?
Yes. So there's a couple bigger fibromyalgia support groups, and I put some links to them too on my website under provider resources, and then I can give them to you too, Mike, and you can put them down below.
Sure.
In terms of like local groups, you can always ask your local provider, but there's a lot of support groups on social media now with the access we have to social media these days. So Facebook has a lot of pain support groups, fibromyalgia support groups, and then even arthritis. The Arthritis Institute has information on how to manage fibromyalgia and things like that. So there's definitely support, and there's definitely access to some of that research that's been going on. I think it doesn't hurt to be part of a support group, especially when you're dealing with a disease like fibromyalgia, where there's still a lot that's unknown. It's nice to kind of see what other people maybe have tried. And, but I like with any type of social media, regardless of the disease or regardless of the reason you're on social media, I always like to tell people, just be aware of negative comments. If someone saw one provider and they said they did nothing to treat their fibromyalgia, it doesn't mean that you can't get a second opinion somewhere else. So sometimes negative comments on social media will sort of get in your head and pull you down, but just know that keep going. There's someone out there that's going to have some type of answer, at least to improve your quality of life more than what you feel like you're getting now.
So, are there any misconceptions or myths about fibromyalgia that you'd like to debunk?
I think there's a couple myths. I think one of the myths is that it's an inflammatory disease, which we kind of talked about earlier with the rheumatoid arthritis. So there's no actual inflammation that they can gauge, within the joints. There's no destruction of the joints that's occurring. I think one of the other myths is that it's not a real disease. I think that's probably what I hear the most. And it's usually I hear from people that don't have it or that aren't diagnosed with it. And similar to like depression and anxiety, there's a lot of people that haven't suffered with it that are very quick to say, it's just mind over matter. You can get over it, things like that. And that's definitely not the route to take with this, because it definitely is a real disease. We definitely know that there are different biomarkers and different things going on in the body with fibromyalgia. So it's real for people that don't believe in it.
So, how can friends and family members best support someone who is living with fibromyalgia?
Yeah, I mean, one of the first things would to let them know that you believe them, that you understand, they're living with this pain, and you don't understand it because you don't have it, but you believe them. I think that's probably one of the biggest things you can do to support someone with fibromyalgia. And then it would also be, to help them when they need help. If they go through these pain flares where it's difficult for them to go grocery shopping, it's difficult for them to go to work. If you have the ability in your life to have extra time to be able to grocery shop for someone, just like you would if someone went and had a knee surgery and they couldn't go to the grocery store, helping them in that aspect to improve their quality of life. Because if you have a condition that makes it hard for you to go out and do something that should seem normal, like going to the grocery store, I mean, that's going to play a big role on their mental health. So their ability to get those groceries, whether it come from you or someone else, is still going to give them that feeling of normalcy during a flare-up of fibromyalgia. So just being there for someone is probably the biggest thing you can do.
So, is there anything else I forgot you would like to mention?
You forgot so much.
I won't be surprised.
No, I'm just kidding. No, I think that kind of covers it without, covering it. Again, there's just so much that, we need to know. But I think we hit it all.
Good. So, where can people find your website again?
So modernispine.com. So it's modern with an I, MODERNI spine.com.
Perfect. Well, thank you for joining us today.
Yes, thank you for having me. I appreciate it. You guys are awesome.
We're A-okay, I guess.
You're okay. For Midwesterners, you guys are okay.
Yeah, we're a bunch of Midwesterners.